I thought there was also an interesting presentation that was given by Jeff Chamberlain. Jeff Chamberlain was trying to figure out, what's an interesting recent finding was that there can be anti-dystrophin or anti-transgene reactions after gene therapy has been given. And so this is concerning. And, we're talking about patients who are receiving a gene therapy that introduces domains which the patients do not have in their DMD gene. So specific exons that are deleted in their in their genotype. And so if we introduce those domains that they do not contain, then potentially you can have an autoimmune reaction. Specifically, there are regions early in the gene between exons 6, 7, 8, 9, 10, and 11, which are suspicious for being highly immunoreactive. So Jeff Chamberlain, what he did was he went back and did some animal studies, and he introduced specific changes within the sequence and introduced them into the MDX mouse to see if he could avoid these anti-transgene effects. And so I thought that was an interesting approach that you could potentially for future versions of microdystrophin, it's a little too late for the current studies, but for future versions of microdystrophin, potentially we can make these changes which still yield a functional microdystrophin, but perhaps are less immunogenic and potentially could be used to treat more patients by avoiding the autoimmune reaction that's been seen in recent in at least two of the recent studies.
And then comes the important questions of the immunoreactions. Because the immunoreaction has two possible consequences. The first one is to produce a serious adverse reaction and or elevation of the liver enzyme at the bare minimum, but in the second time, a possible reaction against the transgene. But the second aspect of the immune reaction against the virus is that the patients can be injected only once, and that on the long run, we could face a lack of expression of the dystrophin and being unable to re-inject this patient. So several strategies have been discussed and are already, by the way, in the literature, like, for instance, plasmapheresis or co-injecting the virus with immunosuppressive drugs or, for instance, nanoparticles of rapamycin. So this uh, is currently under discussion, but of course, this is an additional procedure that needs to be considered when the drug is approved.